Welcome back to my channel. Now let's continue with the fourth part of single lines of rare medicine. So first point, long-lasting effects seem to indicate it as chronic blood poisoning, that is Lactobacillus lactobacillus. It is a spider remedy. So the long-lasting effect may indicate this. Long-lasting effect of Lactobacillus lactobacillus may indicate it as a chronic effect for blood poisoning. This means that just like pyrogen, we can give Lactobacillus lactobacillus for chronic blood poisoning. There is marked action on the nervous system, trembling, sensation of emptiness, stool slips from the anus like lump of jelly mushy. Medicine is oxytrophis. That is in oxytrophis, it has got marked action on the nervous system. There is trembling sensation of emptiness. Here the stool slips from the anus like a lump of jelly and mushy. This is very important. This is an important sentence to remember this oxytrophis. The stool slips from the anus like a lump of jelly and mushy. Oxytrophis. The next point is marked action on the liver with jaundice and the mucous membrane. Persistent sleepiness. Medicine is Mystica cerifera. So the common name of Mystica cerifera is bayberry. So this remedy has marked action on the liver. It can be given in jaundice condition, and also it has marked action on mucous membrane. There is persistent sleepiness. Mystica cerifera. It is Mystica cerifera. Okay. Next, marked skin irritation resembling milk poison oak. There's vanilla. So vanilla, it produces marked skin irritation which resembles milk poison oak. So next point, mask-like expression of the face due to weakness of the facial muscle, that is botulinum. So botulinum is given for paralysis. So here there is no face is expressionless. There is no expression on the face because of the weakness of facial muscles in botulinum. Mental disorder in nervous or aesthetic individual, particularly there is constant fear of death or erotic maniacal attack, then the medicine is diosma linguaris. So diosma linguaris, there is mental disorder in nervous or aesthetic individual who lives in a constant fear of death or an erotic or maniacal attack. Next point, more adapted to hepatic torpor and the gastric attack, common in cold and damp climates, which is aggravated by meat eating and alcohol, told by Hale. Almost specific in oxaluria, the medicine is nitromuriaticum. So nitromuriaticum is adapted for hepatic torpor and the gastric catarrh, especially in hot and damp climate, which is aggravated. This gastric catarrh and hepatic torpor, they are aggravated by eating meat and alcohol. And this remedy is specific for oxaluria. The medicine is nitromuriatic acid. Next, more effective in the beginning of coryza, checking its further development. Medicine is Squillia saponaria. So Squillia saponaria, it is an effective medicine at the beginning of coryza. It checks the further, it stops the further development of coryza. The medicine is Squilla saponaria. Next is about curera. It is very important for the exam. Muscular paralysis without impairing sensation and consciousness. The reflex action is diminished in curera. So curera, the most marked symptom is this diminished action of reflex. There is muscle paralysis, but there is no impairment in sensation and consciousness. So next is also important for the exam point of view. There is mutism of childhood unconnected with deafness. Medicine is Agraphis mutans. Nausea better by smoking. The medicine is Eugenia jambos. Nervous women who do not recover fully, but they are continually irritable and suffer from debilitating sweat, that is castoreum. So castoreum can be given to nervous women who do not fully recover after an illness, but there is continually these females, they are irritable and they suffer from debilitating sweat. So the next medicine is neuralgia, inverted skin eruption. There is chilliness, indigestion with great flatulent distension, told by Clark. The medicine is vaccinum. So according to Clark, vaccinum produces neuralgia, inverted skin eruption and chilliness. Along with there is indigestion with great flatulent distension of the abdomen. So next is neuralgic earache. The pain goes from one ear to the another through the head. The medicine is Plantago major. So Plantago major can be given for neuralgic type of earache when the pain goes from one ear to the another through the head. So next is obstinate skin affections, notably in barber's itch and acne. There is weeping eczema. Medicine is sulfur idatum. So weeping eczema, the medicine is sulfur idatum, and also there is obstinate skin affections, notably the barber's itch and acne. So remember, weeping eczema, sulfur iodate. One of the eye it act more promptly than atropa, much stronger as Midriatric. Medicine is dubiosa. sorry, it is on the eye. That is, dubiosa act much stronger mediatrix than atropa. Okay, so dubiosa is a stronger mediatric remedy when compared to atropa. One of the most efficient and the least harmful tenifuge is cubeba pepper. So tenifuge means it helps in expelling worms from the body. So the most effective and the least harmful tenifuge is cubeba pepper. So the pain in the spot about the third left costal cartilage where it joins with the rib is pix liquida. It is an important sentence for your exam. I have seen this in one of the previous year question paper. So in pix liquida, it is given for the pain at the junction of the third costal cartilage with the rib. Pain in back and sacrum worse while sitting, better walking or lying, medicine is cobaltum. So in cobaltum, there is back pain which is worse by sitting and better by walking or lying. So the pain showed in zigzag course from the lumbar region to the middle of the sacrum. That is, the pain goes in upward direction from the lumbar region to the middle of scapula in a zigzag course. Medicine is Saracenia purpura. So next is very important as a previous year question. For the exam point of view, it is very important. The whole remedy is important. The painful crack in the corner of the mouth is a guiding symptom for this remedy. So the drug is Condurango. So Condurango, the guiding symptom is a painful crack at the corner of the mouth. Next is papilla-like eruption with a vesicular tendency. There is papillar eruption with vesicular tendency, especially in scrotum, also in the hands, tibia, shoulders, and dorsum of the feet. And the medicine is anthracocaine. So next is perifollicular inflammation, a remedy of prime importance in recurring or the chronic boils, particularly when located on the parts thinly covered with muscle tissue, as on shin, coccyx, and auditory canal. The medicine is Calcarea picrata. So Calcarea picrata can be given for perifollicular inflammation. That is for the boils, which can be either recurring or chronic, when it occurs in places or locations which are thinly covered with muscle tissues, as in shin bone, coccyx, and auditory canal. Then we can give Calcarea picrata. So next, persistent desire to sleep. There is dull, discontent mental state, hideous delusion and nervousness, constant motion of finger and feet. Medicine is indole. So in indole, there is a persistent desire to sleep, dull, discontented mental state. The mind will be very dull and discontent. There is hideous delusions and nervousness with constant motion of fingers and the feet. The medicine is indole. Next is itching with piles with much itching. The medicine is petroxylamine. Polyuria while traveling, pain in the region of kidneys, better lying bent backward. The medicine is Kahinka. So Kahinka, there is polyuria while traveling, pain in the kidney region, which is better by bending backward, lying and bending backward. So next point is prevents the formation of calculi, removes tar from teeth and prevent the attack of gout. Medicine is Frageria ves. So Frageria ves can be given to prevent calculi, also to prevent the attack of gout, and it also removes the tar from teeth. So next is important for exam. Prickly heat in the upper part of the body, small red pimples which itch violently. That is Syzygium gembolanum. So Syzygium gembolanum can be given for prickly heat on the upper part of the body, and there will be small red pimples which itch violently. Produce a desire to talk, a flow of language and a courage to make a speech. That is Lachananthus. Lachananthus produce a desire to talk with a flow of language and courage to make a speech. So next is produce more acute ulcerative and follicular stomatitis. Medicine is calicloricum. So calicloricum can be given for acute ulcerations and follicular stomatitis. So the next is prostration after influenza, also tinnitus auricum and deafness, salicylicum acidicum. So salicylic acid, this is salicylic acid. It can be given for post-influenza prostration along with tinnitus and deafness. So the next is proved by W.M.B. Grigg, who found it great value in the most violent form of epidemic influenza, especially with violent vomiting and retching and the great prostration when the R salve has failed. Medicine is sacrolactic acid. So sacrolactic acid, it is proved by W.M.B. Crick. He found that this medicine is most effective in case of epidemic influenza where their symptoms are violent in character, like violent vomiting, retching, great prostration. And in case ourselves fail to cure, we can give sarcolactic acid. Next is pruritus vulva with yellow leucorrhea, worse rest, that is phagopyrum. Phagopyrum, there is pruritus vulva and yellow leucorrhea, and the symptoms are worse from rest. Pseudoleukemia, the medicine is Ferrampric. Next, putrid diarrhea, gastrointestinal derangement, especially in children. The stool look like frog spawn. The medicine is Salicylicum acidicum. So that is salicylic acid. Again, salicylic acid can be given for putrid diarrhea and GI tract derangement in children when the stool looks like frog spawn.